Hi there everyone, welcome to PA Go. Today we'll be looking at the cardiovascular examination, so let's begin. The first thing you want to do is to introduce yourself as with every examination. You want to wash your hands, make sure you have the right patient, explain to the patient what the examination is going to entail, and you can also offer them a chaperone. You then want to do a general inspection. So this happens at the end of the bed, and you're really looking to see if the patient is unwell, any breathlessness, or if the patient is obviously cyanosed. You want to look at the bedside to see if they have any supplementary oxygen or any GTN sprays that might give you a bit of a clue as to what's going on, or whilst the patient is being adequately exposed and the bed is at a 45-degree angle. Next, you want to examine the hands. So you're looking at the fingernails for any signs of clubbing and the hands in general for any peripheral stigmata of cardiac disease. So this could be splinter hemorrhages, Osler nose or Janeway lesions, and you can also look for tar staining on the fingertips as well. Next, you move up to the wrists and examine the radial pulses. Examine the rate and the rhythm as well as the character. Check radio-radial delay in both of the wrists, and you can also check for collapsing pulse, making sure you ask the patient if they have any pain in the shoulder before doing so as a sign of aortic regurg. You can mention here that you'd like to measure the BP, but you won't physically do this in this examination. We can then move on to examining the face. So we have a look at the eyes, looking for any corneal arcus or any xanthelasma. We can look in the mouth for any cyanosis or angular cheilitis whilst lifting up the tongue. And we can also look at the cheeks to see if this patient has any malar flush as well. Once you've done the face, you can move downwards and palpate the carotids one at a time, again assessing the character and the rhythm. And auscultate for any bruits. With the patient's head leaning back and looking towards the left-hand side, assess their JVP. Inspect the precordium again with the general inspection, similar to previous, but this time you're having a closer look, a look down both axillas and seeing if there's any signs of any scars, pacemaker inserts, or any cardiothoracic surgery they might have had in the past. After this, you want to palpate for any heaves and thrills. So essentially, you're seeing if you can feel any murmurs or any signs of LVH. And this is done in 3 areas on the precordium. So one with your hand horizontally at the upper sternum, one across the left side of the sternal edge, another towards the apex of the heart. While your hand is in this third position, now is a good time to locate the apex beat, and the apex beat is the most lateral and inferior position where you can feel the heartbeat on your hand. Next, we want to auscultate the precordium, and whilst auscultating the whole time, we need to be palpating the carotid arteries, and this is so that we distinguish which heart sound is S1 and which heart sound is S2. So the S1 will appear when you feel the palpation of the carotids, and this will help distinguish whether any murmurs felt are between S1 and S2 or between S2 and S1. For example, if you have a murmur after S1, so after you feel the carotid pulse, you hear a small ejection systolic murmur, and this could be aortic stenosis. So there are 4 main areas on the precordium where you want to be listening with your stethoscope. On the upper right and upper left sternal borders, on the lower left sternal border, and down towards the apex. You listen to all 4 areas with the diaphragm, and you just be listening to the lower left sternal border and the apex with the bell side of your stethoscope. And while we're auscultating these 4 areas, still continue to palpate the carotid pulses, just so that we know which sound is S1 and which sound is S2. Spend a little time listening to each area and trying to distinguish whether there are any extra heart sounds or abnormalities present. Having auscultated the precordium, we can now auscultate to see if there's any mitral stenosis. We can use the bell side of the stethoscope and ask the patient if they could turn over onto the left side and have the patient in a left lateral position to see if we can hear any mitral stenosis. We can also listen for aortic regurgitation, so we ask the patient to sit upright if they can. We place the stethoscope, the diaphragm side on the left lower sternal border, and ask the patient to lean in slightly. We can extenuate any extra heart sounds that could be there by asking the patient to take a breath in and the breath out and hold an exhaled breath. We can now auscultate the lung bases bilaterally. If there's evidence of heart failure in the patient, we might hear some fine crepitations in the bases of the lungs. If the patient is normal, then our chest will be clear. Then we want to check for any sacral edema for patients who might be bedbound for a long time with some heart failure, and we also want to be looking at pedal edema, so checking the legs both sides to see if there's any fluid retention and any pitting edema. Now that our examination is over, we can ask the patient to pop their clothes back on, and we can also thank the patient for their time. We'll now need to summarize the examination for the examiner and present any findings that we have found. So now we're going to try and summarize and present our findings. First thing we want to do is say we examined this person, male or female, and also their age, and whether they were comfortable at rest or not. And you want to say if there's any peripheral stigmata of disease that you found. Then, if you haven't mentioned already, or if you've forgotten, but hopefully you've mentioned it previously during the examination, you can mention what the heart rate was, whether it was regular or not, or whether the character was normal or not. Then you can say on palpation of the carotids, if they were normal, and the same as what you found in the radial arteries. Mention the JVP, and also mention the apex and where you located this apex. Comment on any heart sounds, if there were any, or even if there weren't any. You can say there's no added heart sounds, and then mention whether there was any edema present. Once you've done this, for instance, it was a normal examination, I could then go on and say, but I would like to do extra investigations such as check the BP, like you mentioned before, urinalysis, temperature. It can also do part of a GI exam for any splenomegaly. And that concludes summarizing back to the examiner. Thank you very much for watching. If you've enjoyed this video, then please subscribe. If you want to leave any feedback in the comments below, I'll happily take them. So for now, ta-ra, and stay safe.